Welcome. Today, we're diving into the world of congenital heart defects to explore atrioventricular septal defect, or AVSD. This complex condition affects the heart's structure, and understanding it can empower us to improve the lives of those affected. Join us as we unravel the intricacies of AVSD from its causes to its management. The exact cause of AVSD is often unknown, but it's considered a congenital heart defect, meaning it's present at birth. It typically occurs during early fetal development. Genetic factors can play a role, with AVSD being more common in children with Down syndrome. Exposure to certain environmental factors or medications during pregnancy may also increase the risk, but in many cases, there is no identifiable cause. Now, let's explore the heart's inner workings and how AVSD disrupts them. In a healthy heart, the atria and ventricles are separated by walls, the atrial and ventricular septa, and have distinct valves that control blood flow. In AVSD, these structures are not fully formed. There's often a hole in the center of the heart where the atrial and ventricular septa should meet, creating a single, large atrioventricular valve instead of two separate mitral and tricuspid valves. This allows blood to mix between the chambers, leading to an efficient circulation. Oxygen-rich blood mixes with oxygen-poor blood, placing extra strain on the heart and lungs, and ultimately affecting how the body receives oxygenated blood. AVSD accounts for approximately 4 to 5% of all congenital heart defects. Its incidence is higher in infants with Down syndrome, affecting nearly half of them. While AVSD can occur in any population, understanding its prevalence helps us allocate resources and improve screening efforts. The signs and symptoms of AVSD can vary depending on the severity of the defect. Infants may exhibit rapid breathing, difficulty feeding, poor weight gain, and fatigue. They may also have a bluish tint to the skin, lips, and nails, known as cyanosis. Older children might experience shortness of breath during activity, heart murmurs, and frequent respiratory infections. Early detection is crucial to managing these symptoms and preventing complications. Diagnosing AVSD typically involves a thorough physical examination by a cardiologist, including listening to the heart with a stethoscope to detect characteristic heart murmurs. An electrocardiogram, or ECG, can assess the heart's electrical activity. An echocardiogram, using ultrasound, provides detailed images of the heart structure and function, and is the primary diagnostic tool. Cardiac catheterization, an invasive procedure, may be used in some cases to measure pressures and oxygen levels within the heart. AVSD is often classified as complete or partial. In complete AVSD, there is a large hole in the center of the heart and a single, common atrioventricular valve. In partial or incomplete AVSD, there may be separate mitral and tricuspid valves, but there is still a hole between the atria, known as an ostium primum atrial septal defect. Understanding the specific type of AVSD is important for guiding treatment decisions. The primary treatment for AVSD is surgical repair. This involves closing the hole in the center of the heart with patches and reconstructing the atrioventricular valves into two separate, functioning valves. The timing of surgery depends on the severity of the defect and the infant's overall health, but it's usually performed within the first few months of life. After surgery, children may require ongoing medical management, including medications to manage heart failure and prevent infections. Regular follow-up appointments with a cardiologist are essential to monitor their progress. Currently, there's no definitive way to prevent AVSD. However, ensuring women have access to good prenatal care is vital. This includes folic acid supplementation, avoiding harmful substances like alcohol and tobacco during pregnancy, and managing pre-existing medical conditions like diabetes. Genetic counseling may also be beneficial for families with a history of congenital heart defects. The prognosis for individuals with AVSD has improved significantly with advances in surgical techniques and medical management. Most children who undergo surgical repair live long and healthy lives. However, some may experience long-term complications, such as valve leakage or heart rhythm problems, requiring ongoing monitoring and treatment. Research is ongoing to refine surgical approaches, develop less invasive procedures, and improve the overall quality of life for individuals with AVSD. Understanding this defect and supporting continued research are vital for bettering the lives of those affected. Thank you for joining us on this educational journey into the heart of AVSD.